Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. On today's episode, we're going to be talking about feet, and more specifically, flat feet. Now, you might be surprised to hear me say that of the thousands of people that I have treated, only 2 of them actually truly had flat feet, even though a lot of people feel like they do. So in today's episode, we're going to be talking about why no one really has flat feet, except for those 2 cases that I've seen, why it's important to fix flat feet, why it is so hard to treat the feet, and then finally, we're going to talk about orthotics and when to use them and how I like them to be actually molded. So let me first talk about those 2 gentlemen that actually truly had flat feet. Both of them were cases where something came down and crushed the top of their foot, which led to multiple bones breaking in through the middle of their foot or their midfoot. One case was a construction worker that was working on a house and a cinder block came down and crushed the top of his foot. And the other gentleman was actually taking a dune buggy out of the back of his truck and it came and crushed the top of his foot as well. So both of them ended up being casted, and it really was because of that injury on top of the foot that led to the flat foot. So what are these other people that tell me that they have flat feet? What are they actually suffering from? They're suffering from an arch that is too high, that actually it's way too high in their midfoot. And what happens is they compensate in the back of their foot, like where their ankle is, or what we call their rear foot, collapses inwards so that the big foot, like the arch of the foot, can touch the ground. Why would this happen? Why would the body do that? Well, you have tons of nerve endings in your toes, especially your big toe. It helps with your proprioception, or your body's realization of where it is in space. So if you were to close your eyes and somebody hold your arm out to the side, you could tell them your arm is getting held out to the side because of proprioception. Your body knows where it is. And balance is really important when it comes to proprioception. So your body wants to have this input from the nerves of especially the big toe going up to your brain to tell you where you are. And so if your arch is too high, then your big toe wouldn't be touching. And so what happens is the back of your foot collapses so that you could get that information. So really the issue with most of these people with flat feet, unless they've had an accident where there's been kind of a crushing injury on top of their foot, they actually have too high of arches, and that's what needs to be fixed. When assessing someone's foot to see if they actually do have this really high arch, it's important to get their foot while they're standing into what we call subtalar neutral, or where the back of their leg is fully stacked between their tibia, their talus, and their calcaneus, or basically their ankle complex. You want to see it stacked right on top of each other. And when I do this, when I get someone into this subtalar neutral position, which I'll explain in a second how you can do this on yourself to kind of see what's happening, I've had cases where when I get them in that neutral position through the back of their leg, they'll actually only have maybe 2 toes touching the ground. They might have their pinky toe and their 4th toe touching the ground. All 3 of them might be up. I've even had with more advanced cases where I had one guy who had multiple other spinal deformity issues. When I put him into a subtalar neutral, he was weight bearing just on the outside of his pinky toe. That's how big the arch was of his foot, that when I had him in neutral in the back through his ankle, only his pinky toe was touching. So that person and all these other people, they have too high of arches. And like I said, you can't go walking around on the outsides of your feet. That's not very stable. It will start to hurt. It doesn't feel good. So what your body does is it compensates and it kind of just collapses through your ankles so that you can feel the weight bearing through the rest of your feet, and you will have more of that nerve impulse and sensation from your toes going up to your brain. So you have this idea of proprioception of where your body is in space. So that's what I'll see when I put someone into the subtalar neutral position or put them in through a nice neutral position through the back of their leg. Then I understand really what is their arch doing, because it's when I'm trying to get someone into a more efficient state of their leg being in a nice neutral position. That's what I want to try to work for. And if it's the arch that's too high, I need to treat that arch. So how can you find this out on yourself? Well, you'll need somebody to help you with this. The best thing to do is to lie on your stomach and have your feet kind of going off the edge of the bed. And what you're going to do is you're going to have somebody flex your foot up. So almost like trying to have it as if you were standing. So don't have your toes pointed. You want to have them flexed. And they want to draw a line with pen down the back of your leg, kind of the last third of your leg, going right down the center of your Achilles tendon. So you want to feel for that rope-like structure that's in your ankle. That's the Achilles. And you want to draw a pen line right down the center of it, all the way down to the bottom of your heel. Then go in standing, and you can look in the mirror, have someone take a picture too, and see what is the curvature of that line. Is it concave in? That means you're collapsing through your rear foot. Or is it straight up and down? We want to get the straight up and down. So if you have that kind of curve going inwards, then try to roll your feet out a little bit to try to get that line as straight as possible. And that would be getting yourself into subtalar neutral, that neutral alignment through the leg. And when you do that, what's touching the ground and through your toes? How does your arch feel? And that kind of gives you an idea of how much dysfunction you're having through your foot that's causing you to have these flat feet. So it's a kind of a great way to assess on yourself, is just draw that line. And for therapists too, this can be beneficial for you as well to really see the change of that curvature and what happens. So drawing that line down through the center and then seeing what happens when you change how that line is shaped and what occurs through the rest of the foot. So this is why I say that most people truly don't have flat feet. They actually have too high of arches in that compensated supinated foot. So why is it important that we treat this out? What's the big deal if our foot is positioned like this? Well, it's because of everything that happens from the ground up. So if you're stepping and having to do these weird compensations by collapsing in, there's usually rotations, that will be mimicked up the rest of the body. So what I love to show people is to get them to understand how important their ankle alignment is and how their foot alignment is to what's happening elsewhere in their body, like with their knees or their hips or their low back. I will trace out their legs. So I'll be sitting behind them on the ground, and they'll just be standing in front of the mirror. And I just put my hands on either side of their leg, like we'll just say their right leg, and I just trace my hands down, and you'll see based on like where the musculature, if there's rotations that are occurring through the thigh bone or the femur going down into the tibia and fibula, the lower leg. And you'll see this kind of twisting that occurs when someone has a compensated supinated foot, when they don't really truly have that flat foot. And then when I put them into that subtalar neutral, get that line on their Achilles right up, down, and straight, and have them stay there and hold there, I go back and retrace. And I would say 99.9% of the time, their leg is completely straight. So it starts to make them understand, like, why do I have knee pain all the time? Because knee pain is usually just kind of the effects of dysfunction of either the foot or the hip. So in this case, it'd be a dysfunction with the foot. So if you have that compensated supinated foot and collapsing in, it will cause rotations of the tibia versus the femur and causes torsioning on the knee. So now imagine you've twisted something like your knee, and now you're trying to run on it. Now, can you understand how there'd be this abnormal pushing and pulling that might lead to, let's say, the patellar tendinitis or a meniscus tear, or make you more susceptible to an ACL or an MCL tear? Yeah, it could all be coming from the foot and the alignment of the foot and how much pressure you're putting on it, because the body is not meant to take these abnormal pressures. It's supposed to work as efficiently as possible, but when it's out of alignment, it tries to compensate as much as it can until it can't anymore. So that's usually when you'd be going and seeing a physical therapist or having pain, is when it just can't compensate anymore. But the issue could be your foot and the alignment of your foot. This will also go up to the hip too. This can cause issues through the hip and the low back, depending on what people are doing and depending on how long this dysfunction's been going on with the foot. So even if I have a patient coming in for hip issues or kind of low back or SI joint issues, I might be working on their foot to fix the problem, because every time they're stepping and walking, there's this abnormal force that's going through their body that's going to be affecting change elsewhere and putting too much pressure on other tissues. So it's important that we work from the ground up sometimes if there's a big dysfunction on the foot, because as you're moving through life, it's just going to be repetitive stresses on those tissues that don't need to be there if that arch is too high and you're having to compensate by collapsing through your rear foot. So if we know that it's bad for us to be walking around with this compensated supinated foot or quote unquote flat foot, how do we treat it? Well, treating the foot is actually really hard. It's because you're always walking on your feet, unless you're in a non-weight bearing position, like you're in a wheelchair or you're on crutches and not bearing weight through that foot. I mean, it's just repetitively going in and going to feed into those old compensations. So sometimes when it's treating the foot, it's like you take 2 steps forward, 1 step back, 3 steps forward, 1.5 steps back. It kind of is pushing, going forward, making gains, and then sometimes it slumps back again because you're just repetitively walking on your feet over and over again. And it's hard to, in one session, be able to correct the foot completely. So don't be disappointed if you have this flat foot and you need to get it treated or that's leading to their dysfunctions, that it's going to be a little bit like you move forward and you kind of move back a little bit because you're using your body, you're walking around. It's a lot harder to take an ankle or foot out of your everyday life than it would be like your hand or turning your head. You need your feet. You're always going to be on your feet. So when you're treating this area, how do I fix it then? The first thing I need to fix is treating the arch. I need to get the arch in a better position. And that means getting these bones called your cuneiforms. There's a first, second, and third, and it's kind of right in the middle of your foot. I need to get those down because usually those are the ones that are too high. They're pushed up too high, and I need to get them down. And if I can get those down, then your toes will have contact with the ground and you don't need to compensate through the back of your foot. It is amazing when you can get these bones down. People stand up and just feel the total difference of how they're weight bearing through their feet. And they feel like they have more contact. They have better splaying through their toes, that there's just more feedback they're getting, and they don't have the pain through their ankles or through the arches of their foot. So the important thing is to first go after this cuneiforms. I actually have a video of this on my Instagram as well, but one way to treat it yourself. The first thing is, you want to clear up the tissues on the bottom of your foot as much as you can, because those muscles are usually too tight. And so if I'm trying to push a bone down, it's not going to go anywhere if the muscles of the bottom of the foot are too tight or the muscles of the arches. So I always have my patients roll their foot out over a ball when they're sitting. I don't like the standing and really cranking their foot into a ball. I think you should just be sitting. A cross ball is the best. It has a little bit of a give to it. If you need to do a golf ball, you can. Tennis ball has a little bit of too much give to it. But you just kind of want to massage at the bottom of your feet, relax the arches and all those muscles so that when you go to try to mobilize those cuneiforms down towards the ground, they're able to do it easier, that there's some place for it to go. It's not getting held back from this muscle tension underneath. Then what you do is you stick, so say I need to mobilize the bones of my left foot. I would have rolled my foot out over a ball, like 15 minutes. I like to have it people do while they're watching TV and sitting down for the night, just roll their foot over. And then stand up, and you're going to place the heel of your right foot onto the arch of your left foot if I need to mobilize the left. And you're going to find where it feels stiff. Just as you push down that right heel, feel where it feels stiff and through the bones. And you can also look up cuneiforms and see where the cuneiforms are. Once you find that stiffness, you're going to try to push your heel down to the ground as you bend your left knee and straighten your left knee. So kind of just doing little plies to that side while continuously pushing down with your right heel. This will start to mobilize the bones, and it's kind of a self-mobilization. Now, it's going to take a while to do this. You can do it quite a bit to get those bones to move, because depending on how long this has been a dysfunction, it's going to take a little while to fix. Like, my daughter had cuneiforms that were too high right when she was born because she was a big baby. So let me tell you, it was 2 seconds to mobilize those cuneiforms when she was only hours old, compared to someone that's in their 60s. Like we'll say, doing my father's feet, trying to get his cuneiforms down are a lot harder. So, the younger they are, you can fix the feet issues a lot sooner than the older you are. So it's going to take a lot to kind of mobilize for those bones. So don't expect huge gains when you're doing this yourself. Then we have to work the intrinsic muscles of the foot. So the intrinsic muscles are those deep muscles and kind of what create the arches. Now, if that's how you're going to get the greatest carryover from your treatments of your foot is if you start to work those muscles, because I can get the bones moving as much as I want, but if I don't train those muscles how to stabilize those bones in that right area, they're just going to pop right back out of place again. So, one way to do it is kind of toe, like crunch motions of trying to move a towel, kind of raking your toes across something. There's another one too, where you go from kind of having your foot pointed, but your toes are flexed up in the opposite way, like as if you were trying to go up on your toes if you were dancing, not on point. You go from that position to then ankle going the other way, where you're trying to bring your foot up, so the opposite of pointing, but then you point your toes. So it's a little confusing. You go from pointed foot with opposite flexed toes to flexed foot with pointed toes, kind of going back and forth to work the intrinsic muscles of your foot there. What also can help when you're treating this area is to tape up the arch just a little bit. Now, that doesn't mean some crazy taping job, but just a little bit, going from the bottom of your foot, wrapping around to the top part of your arch, going through the inside of your foot. And taping that up just gives a little bit of a lift to hold you there while you're walking throughout your day. I will post a taping picture on my Instagram as well of how to tape the foot so that you can start to gain some strength through those intrinsic muscles without having some big kind of like orthotic having to hold you there. So you want to learn how to get the foot working for itself. You want to mobilize those tissues, but then also be able to train the muscles how to hold you there. But remember, it's going to be like 1 step forward, a half step back, 3 steps forward, 2 steps back, and back and forth until you kind of gain that range and gain that strength. So it's not going to happen overnight. The feet are really tricky to treat. So you have to stay strong and through there. So one treatment of the feet is using orthotics. And I'm going to give my 2 cents on orthotics here. I only have someone fitted for orthotics after I've done as much work as I possibly can on the foot. And it just could be one of those things that it's a dysfunction that's been there for a long time. I did as much as I possibly could, and then they just need to get fitted for orthotics. I prefer over-the-counter for people that have pretty good feet. Unless they have really big issues, then I'll have them fitted for custom orthotics, but usually just over-the-counter. And I actually really like Superfeet. The brand Superfeet, obviously no affiliation with them whatsoever. I don't get any kickback from them, but I really do like the brand Superfeet to kind of just have a little bit of insert into your shoe if you need it. It's not a lot, so it's not overcorrecting through that area. Because the issue with custom orthotics is that it has a really low compliance. People don't like wearing these custom orthotics because it really starts to hurt. And does that make sense? Like, why would it hurt if it's making it so that it corrects your foot to the position it should be? Well, it's because your body has been accustomed to being in this bad position for so long. It's been used to these torsioning happening through your system, right? Like if you were to trace out the leg, like I was talking about, like tracing down the leg to see what rotations are happening through the femur or the tibia, then all of a sudden you put them into a custom orthotic. It's supposed to correct everything, but those tissues going up through the body aren't used to that, and it takes some getting used to. So even when I'm treating someone's foot, I'm usually treating all the muscles and I'm going up higher, understanding what's happening through that kinetic chain, what's happening as we get through the knee and through the hip and the low back as we correct their feet. So if you just go straight to custom orthotics without getting any sort of treatment done to the area, compliance is usually low because all of a sudden people are like, oh, my back kills or my feet really hurt. There's like this abnormal pressure here. Or there's pain in through the knee because their body's not used to being all of a sudden thrown into this proper alignment. And it's not allowing, if the orthotic is really stiff, it's not allowing for like proper splaying of the foot. It's not allowing for that kind of retractability of the foot where when you weight bear, it opens up, everything should kind of spread, and then it comes and retracts back as you step out of it. You're not weight bearing anymore. The orthotic just kind of holds you into a two-step of a position. So I'm actually not the biggest fan of custom orthotics. Some people they work really great for, but like I said, I usually don't send patients to get them until I have already treated out everything that I possibly can And then it's kind of like, all right, this is the last step. I've taken you as far as I can. I've treated out everything else. Let's get you fitted for orthotics. And then it's going to be kind of working into those orthotics. It's going to be getting their body accustomed to it and treating out aches and pains as their body gets used to being put in this abnormal position. If you're going to get custom orthotics, I'd say have them correct on the lesser side rather than too much. Like I said, a perfect correction usually leads to too much pain and low compliance, and orthotics can be expensive. I mean, we're talking hundreds of dollars for orthotics. So I would have them go for less than more. There's a couple ways to get fitted for orthotics. My preferred preference is actually to do a casting of the foot in a non-weight bearing position. And when you would cast someone for their foot for this, you put plaster around it so they can see where the foot is, and then the therapist holds them in a position so that they're in that subtalar neutral. So that would be that perfect alignment of that line down the back of the leg through the Achilles. So you hold the person there until the plaster dries, and then that's the cast that the orthotics company uses to make the orthotic. I don't really like the ones where you have to do it in standing, because usually you're just standing in a wrong position. And if you do one of those standing ones, then you need to have someone holding you in that subtalar neutral position so they make sure that you're not collapsing and doing all those weird things. So these machines out there where you can go to the pharmacy and you stand on a thing and it tells you which are orthotic to buy, I'm not a big fan of those ones. You just want to have a little bit of an arch support of anything. Because like I said, everybody's actually has too high of arches. So you just want a little bit of support as you work through your foot to then help have those muscles work. But when it comes to mobilization and getting, real treatment, if you're going to go for the custom orthotics, because that's what your physical therapist is deemed as necessary, it's really important that it does a little bit of a less correction than an overcorrection. So I hope today's episode is a little bit of an eye-opener as to maybe you don't have those flat feet, but you actually have too high of the arches. Go ahead and test it out for yourself and just kind of see what happens when you get that line through the back of your leg in a nice stacked position and how the rest of your body feels. And remember, the foot is really hard to treat. So just be realizing that there's going to be a little bit of forward progression, then a little backward progression until you kind of get to that final stop. Over-the-counter orthotics are my preferred over custom orthotics, but if you need to have that custom orthotics, it should be that you've done everything else you possibly can to get your body in the right position before you get fitted for those custom orthotics. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.